Hi, my name is Dr. Jason Hochfelder. I'm an orthopedic surgeon with Hudson Valley Bone and Joint Surgeons. Today we're going to talk about hip replacements, and specifically the different ways that a hip replacement can be performed. Hip replacement is one of the most common procedures that we do, most often done for severe osteoarthritis or wearing away of the hip joint. What it involves is replacing the worn out ball and socket. As you can see here, either metal or ceramic ball is used to replace the ball part of the thigh bone, and the socket is replaced by a metal cup, which is seen over here. Today what we're going to talk about, as I mentioned, is the different ways that a hip replacement can be done. The two most common ways are anterior and posterior. Here, we essentially do almost all of our hip replacements via the anterior approach, which is a minimally invasive approach and a way that has a lot of benefits in terms of recovery and outcomes from a hip replacement. Benefits of the anterior approach, which involve coming into the hip joint from the front of the hip with the patient lying on their back, as opposed to the posterior approach, which involved making an incision on the side of the hip and then going in from the back of the hip joint, include a few things. Number one, a decreased rate of dislocation. A dislocation is when the ball pops out of the socket, a very uncommon side effect or complication from a hip replacement. When the hip replacement is done from the back or a posterior approach, that risk is about 1.5%. When it's done via the anterior approach, which is the way that we do, that risk is down to about 0.5%. It still exists, but it's significantly lower. In addition, because the risk of dislocation is a lot lower from an anterior approach, there's certain things that you can do, such as sit in a regular chair, cross your legs, and bend over, that you really shouldn't do for the first 6 weeks or so after you have a posterior approach hip replacement. In addition, because when we go from the front, we're able to go between muscles and don't have to detach any muscles from the hip. When you have a posterior approach, there's certain muscles that you actually need to take off from the hip joint and then use drill holes and drill them back onto the bone. And because we don't have to do that from an anterior approach, recovery tends to be a little bit faster because the muscle recovery is a little bit easier. In addition, when a patient has an anterior approach hip replacement, the surgery is done with them lying on their back. Because they're lying on their back during the operation, it's very easy to bring an x-ray machine in and out. Because we can bring an x-ray machine in and out, we can actually look and see what the hip replacement will look like before we're done with the operation. When you have a normal posterior approach hip replacement, you can't actually take an x-ray till you're in either the recovery room or at the very least until the incision is fully closed, and then you're transferred onto your back and you just hope that it looks good. When you do an anterior approach, if you don't like how it looks, you're staring right at it and you can make little fine adjustments. This has another benefit in that a hip replacement can lengthen or shorten a person's leg. It's difficult to tell when a person's lying on their side, but when you're doing an anterior approach hip replacement, it's very easy to tell using both x-ray and certain anatomic landmarks whether the hip is being lengthened or shortened. And because the person is on their back, you can actually take x-rays of one hip and the other hip, and even the hip that you're not operating on, and compare them to make sure that they're as even as possible. So for all these reasons, as well as a few others, such as quicker time to walk, lower length of stay in the hospital, and so forth, here in our practice, we primarily use the anterior approach, minimally invasive, image-guided hip replacement. But you should certainly talk to your doctor about the pros and cons of each way, and we'd be happy to talk to you about that as well.